Okay, perfect. I think we're good to go. I'm going to start.
Uh, Hello, welcome. Thank you guys for joining us tonight. My name is Dr. William Bearden. This is Zach Pipkin. We have a great presentation tonight about fresh face, and brighter eyes. And I'm glad you all could join us. And if you're having any sort of um, hiccups connecting, let us know. But also any questions as we move along here in our chat. Please add those. We'll get to those either during or after the presentation. So with no further ado, let's move forward. I guess I'll introduce myself first. I do occipital surgery. I've been practicing in Richmond for, I guess, a little over 20 years now. Hard to believe. And specialize in plastic and reconstructive surgery, cosmetic surgery around the eyes. And so I specialize, it's kind of my super specialty. And so really enjoy talking about this area. And it's been a favorite part of what I do.
And again, my name's Zach. Nice to meet you guys. Thanks for joining tonight, taking time out of your day to come listen a little bit about lasers, light therapy, and biorejuvenation. Just a little bit about me. I started in the neonatal intensive care unit in the middle of COVID in 2020. So been a nurse for 5 years now, and I got to join the aesthetics team last year with Dr. Bearden. Really been enjoying working with him and learning from him. So have a lot to share with you tonight about skincare and how laser and light therapy can benefit skin health. And then something else wanted to mention is that any aesthetic services provided by me are overseen by Dr. Bearden. So you always have that peace of mind knowing that he's overlooking the treatment plan that we work out for you. So covering tonight's agenda, just going through really quick, we'll talk about the aging process, biorejuvenation and aesthetics, and what that kind of means. Skinpen microneedling, which is a service that we offer, as well as BBL Hero, does not stand for Brazilian butt lift. It is a light-based therapy. Halo hybrid fractional laser. We'll talk about PDGF, which is the newest product that we're bringing to the office, and when to know when it's time for eyelid surgery, and kind of what to expect with eyelid surgery, and see some before and afters. So going over the aging process, it occurs at multiple levels. So we're not just aging at the skin level. We have changes in our bone structure. We have the jaw and the midface start to resorb. We have widening of the orbital socket. We have loosening of the retaining ligaments of the face, which causes tissue descent. And we have changes in our fat pads. They kind of shift around. The ones that you want to stay the same get smaller, and then other ones get bigger, kind of contributing to that sunken appearance. And we also get, with that laxity and wrinkles, as well as ptosis. And
A big recurring thing you'll hear tonight is, basically deflation or things becoming lax. And so a lot of what we're going to talk about are ways to slow that down, reverse that to some degree, and ways to work around that to try to rejuvenate things around the eyes. But it's a lot of it's about revving up tissues that you want revved up and things that atrophy as you age, but also, using making up where things are deflated or depleted. So we'll go over more of that.
yeah, and so you can kind of see that aging happens from the bottom up. It's kind of everything, everywhere all at once. But one thing that I thought was important to mention too is that there's absolutely nothing wrong with aging. Obviously, it happens to all of us. There's nothing wrong with doing nothing aesthetically. Some of the most confident people have had zero aesthetic work done, but we think it's up to each individual. A lot of people might feel hesitant about jumping into aesthetic procedures. They kind of see it as like an all or nothing approach. We've all seen overdone faces, overfilled faces. So what we're trying to do is kind of enhance the features that you already have and just make you feel or make you look like you feel inside. So, and that kind of brings us to biorejuvenation. And that's kind of where it comes into play. A lot more people are interested in treatments that are going to stimulate the body's own repair mechanisms. And there's a growing demand for these treatments, and people want to understand, what is biorejuvenation, and also understand traditional aesthetic treatments too, like Botox and filler, and how can we combine them for the best aesthetic result. So biorejuvenation is really cool because it's encouraging collagen and elastin production, and you can do that through lasers and light therapy, biostimulatory fillers, the PDGF, which we'll talk about, which stands for platelet-derived growth factors. And these are kind of used as a sort of preventative as well as a rejuvenative treatment. One person I wanted to point out was Anne Hathaway. I think we've all seen pictures of her recently looking really great. And if you look at the picture of her from 2001 to 2022, I mean that's a 20-year difference. So she's had a good injector, a good aesthetic provider, a good surgeon that's been looking after her in some form or capacity. Obviously, we don't know what she's had done, but it's been subtle tweakments, I would argue, that have kind of given her just a refreshed appearance, but she still looks like herself. Another reason I wanted to bring up this photo is if you look at the picture in 2022 and the picture in 2025, you notice less hooding in the upper eye area. It's likely that she had some sort of upper blepharoplasty, I would think.
So, yeah.
Yeah, so a lot of magazines and people in the aesthetic world are calling 2025 the year of the blepharoplasty because it's such a profound surgery that can be such a subtle surgery. It's a smaller surgery in the grand scheme of like a deep plane facelift, but it can make such a big difference in your face and the way you feel. 60% of the time that we're communicating, we look at people's eyes specifically. So it's a really profound aesthetic change that you can make for yourself.
And a big part of all these mechanisms and different ways to address issues, and be it biostimulatory mechanisms or filler or surgery or skin resurfacing, the goal and what's always top of mind for us is having a natural appearance. What I always tell patients is I'd like for people to see you afterwards and have a hard time putting a finger on what you had done until they see your pre-op or pre-treatment photos, and it becomes more obvious. So something that doesn't catch the eyes, but surgical is really top of mind and a big deal. So
Yeah, and Dr. Bearden always says like good cosmetic work is undetectable, and so that's really how it should be when you're seeking aesthetic treatment. So you want to find providers that kind of align with that aesthetic goal, if that is your goal. It's not everyone's goal. Some people really want to modify their appearance from their baseline, and more than happy to find providers that can do that. But it's always top of our mind to have more of like a natural appearance. So one of the ways that we can do that is with microneedling. It's a popular treatment that a lot of people might know a little bit about. We use the Skinpen in our office. It is best done in a series of 3 to 6 treatments. Some people are happy after just one, but it usually takes a couple to start seeing your collagen ramp up. So you're creating these controlled micro injuries in the skin. You're actually making 1,600 microchannels into the skin per second. So it's creating a lot of injury to the skin, which triggers your body to produce collagen and elastin. Starting in our 20s, we have a decrease in the collagen production of our skin cells. And so doing microneedling and lasers can kind of tune that back up to where it was when you were younger, kind of help you maintain your skin integrity. And you can see here that it's actually FDA cleared for neck wrinkles and acne scars. So a lot of what we do in aesthetic medicine can be potentially off-label. Like Botox was originally FDA cleared for treatment of wrinkles in one specific area. Obviously, people can get it in their forehead or around their eyes to kind of soften those lines as well. So that's what we mean by FDA cleared. So things don't have to be FDA cleared in aesthetics, but it's nice to know that with this treatment specifically, they've gone through the process of proving that this treatment is effective for some types of wrinkles and some types of scarring. I don't know if you want to add anything about Skinpen.
no, I think you covered it.
As far as like what's involved, you come into the office and it's like a 45-minute numbing time. So we numb you beforehand, and then the device will I'll apply a slip to kind of let the pen kind of smoothly glide over your skin. We'll create those microchannels. And then when you leave the office, you may be really red, have some pinpoint bleeding. Usually the redness lasts about 24 to 48 hours. And then you'll kind of notice improvement within a few weeks in your skin texture, and you'll continue to get results for several months.
One great thing about really quickly about Skinpen that is a little bit different, although it doesn't replace some other treatments, but I think as far as stimulating collagen and what it does, it's one of the treatments we offer that is more amenable to doing during the sunny months. It's more, certain light devices and things that kind of you lose a lot of the epithelium or outside surface of the skin aren't as amenable because there's some pigmentation issues and sun exposure issues. But for Skinpen, it works in different mechanisms. So it's really the way to go for a lot of the warmer months when other people would otherwise postpone having something like, we'll talk about it a little bit, but any lasers or
BBL.
Or BBL.
Yeah. So BBL stands for broadband light. You may traditionally know it as IPL or intense pulse light. This is just the brand of intense pulse light that we use. It's made by Cyton, which is one of the best laser companies in the game. And basically what this allows us to treat is dyspigmentation or discoloration in the skin. So a lot of what can age you or make you feel like you're just not looking like your best self is uneven pigmentation in the skin. So the reds in the skin, the browns in the skin that are kind of up against your natural skin tone just create this kind of this look where things aren't harmonious. So we can actually use this device to create a more even skin tone. Also helps with collagen production with consistent use. And it can help treat things like acne scars. We can do hair removal with it. Can also be a good treatment for rosacea as well. How it works is the handpiece, which you can see being applied to somebody's back, is a large crystal and it's cooled. So it's pretty chilly since the device outputs that heat. And I apply some ultrasound jelly, and I think it's in the next slide. Yeah, so you can see in the face here. So you come into office, we apply the ultrasound gel. There's really no need for numbing. It's pretty well tolerated by most people. They kind of describe it as like a warm rubber band snap sensation. And it's about 45-minute procedure. You can go back to work the same day. There's really virtually no downtime with this, I would say. You might be a little bit flushed and warm, like you've just had a sunburn. Your skin may feel a little bit tight, but most people are fine to just return to their normal activities. There are some restrictions, like we want you to avoid hot saunas, hot showers, exercise for the 48 hours following the broadband light treatment. And this is why. So if you kind of look at how the device treats broken blood vessels in the skin, the light is absorbed by the blood vessel, which collapses the blood vessel, and then your body resorbs that content. So that's how we kind of can treat those superficial, tiny blood vessels that are on the skin. Oftentimes, you don't see them. Looking in the mirror, you just notice background redness. But if you get really close with the magnifying mirror, you'll see basically, like it says, small spider veins, but on the face. One place that they really like to hide is the corner of the nose as well. So that's a great place to hit those.
And the reason, and maybe you're going to get to this, but one of the reasons, one of the limitations is things where you exercise or anything that might make you flush is because if you refill those blood vessels that we just collapsed, then it kind of undoes your work. And so that's one of the few limitations with that. Otherwise, pretty seamless procedure. There's not much downtime with. So
yeah. And with the pigment,
this is for like a day or two. So
yeah, exactly. Yeah. So the heat would just dilate the blood vessels, pop them back open, which we don't want. So that is some downtime. We also want you to discontinue any actives like your AHAs, BHAs, tretinoin, retinol, whatever you're using active wise, a week before and a week after. And how it treats the pigmented lesions in the skin. So we use usually around yellow light spectrum. And what this does is it kind of busts up the pigment and kind of breaks it up and allows that pigment to fade. It either peels or sloughs off, or sometimes it'll just get really dark and then gradually lighten over time. Kind of depends on your skin type and what those age spots or sunspots look like before we get started. And as you can see, kind of talked about it here, but good for acne and hair removal as well. So here we have some before and afters. So on the right hand side with the chest, you can see somebody's response. This is not my patient. These are from Saiton, but one treatment session on the upper picture, and then on the lower picture, that individual went through 3 treatments. And that basically just segues into showing you that everyone's skin is different. So somebody can have an amazing response and clearance of sunspots and pigment in one session. And then some people may need more than that, especially if you have a darker skin type, we have to be more gentle. So just kind of shows you why, everyone's skin is different. And with this device, we do usually recommend a series of treatments for best results. You can always try one treatment session, like my friend on the left that I treated. But usually it's best seen with 3 to 5 treatments because it is comfortable, fast, effective, low downtime. Usually with things like that, you need a series. And that's why microneedling, you need a series. BBL, you usually need a series. These are also spaced 4 to 6 weeks apart. And contraindications for this isn't a device for the darkest of skin types. It's cleared for skin types 1 through 5, which is basically everyone, but like deep dark skin. You can, if you have like a lighter olive tone or a caramel color tone to your skin, be treated with BBL, but there is a higher risk of hyper and hypopigmentation, or burning from the device because the device is targeting that pigment in the skin. So we usually recommend this for our fair skin patients. But if you ever have questions about, is my skin type appropriate for this treatment, we're always happy to answer that question. And then on the left here, my friend that I treated, again, just one treatment. So not like, she didn't get the results that she would have gotten if she had come back for several treatments. But if you pay attention to the forehead, these sunspots here on her forehead, and just how much better her dyspigmentation is on the forehead, and then the redness in the T-zone here. She's got some background redness at baseline in her T-zone, and you can just see afterwards she just has like a nice healthy glow, more even skin tone. Something else that we want you to be careful with when you're doing lasers and light-based therapy, like Dr. Bearden said, is sun exposure. So usually we kind of call wintertime laser season because people are out of the sun more, so it's easier to get these treatments done. That's not to say that you can't have these treatments during the summer months. In fact, my friend on the left, she went to Costa Rica, I think a few days after this treatment, but she was really good about using, her SPF 50 or higher, reapplying it using a broad brimmed hat. So there are strategies that we can give you to work into your lifestyle to do this treatment, but generally reserved more for the cooler months, I would say.
It's true, and I mean, I think that's it's the easiest time of year to do it, the winter months. But if someone's committed and has good hygiene with their sunscreens, or I should say, good sun hygiene with sunscreens and hats, that sort of stuff, it's doable. But it's a little more of a commitment, which for some people that's okay. But we talk that sort of thing through with you.
So now we're going to talk about Halo, which is kind of what I like to call BBL's big brother, sort of, when I have consultations with patients to kind of help them understand where in the hierarchy it fits. So this is also going to treat some of the dyspigmentation in your skin. It's not going to do it as well as the BBL. That's really the BBL's bread and butter. But what this device does do is it also helps with pore size, skin texture, fine lines and wrinkles. It's not going to treat any super deep wrinkles, but we can really tune the laser is very tunable to address deeper skin concerns if you have them, based on what type of downtime you're looking for and what you're willing to accept for treatment. This is the world's first hybrid fractionated laser, which is kind of a mouthful, but it's really cool when you get into the science of it. So if you zoom into this skin picture here, so the laser stacks two wavelengths on top of each other, and it fires them coincidentally, so at the same time. So on the bottom here, you can see the first wavelength of the laser is penetrating deep into the dermis, and it causes coagulation or death of the tissue. And that's another method that we use in aesthetics to, again, stimulate collagen and fibroblast production, turn on the healing, turn on growth factors in your skin cells, and kind of refresh your skin from a dermal level. And then the top injury here is like a microscopic scoop, I like to call it, out of the epidermis. So the laser is firing and it's ablating or removing skin at the superficial level. And that allows this deeper, the tissue from the deeper dermal injury to kind of come up and out and exfoliate off. So that's what's really neat about this laser. This is also safe for all skin types. Unlike the BBL, we can tune this for all skin of color, which is really great. And it's just one of the most advanced skin renewing tools that we have. I don't know if I have, yeah, so I don't have another slide on this. So with before and after care, just really quickly, so you guys have an idea of what to expect. This does require numbing, so you'll come into the office and numb for an hour, and then we treat you for 45 minutes to an hour, depending on the treatment area. Usually really well tolerated. As far as what to expect after, most people describe an intense heat, kind of like they have a really bad sunburn for about an hour and a half, 2 hours. And then pretty much for everyone universally, the heat just dissipates at that hour and a half, 2 hour mark. You still look like you have a sunburn, but you don't feel like it. And then over the next few days, the redness subsides. You're still a little, you might have some swelling the first 2 days. And then over the next few days after that, you get some coffee ground like spots showing up on your skin. And that's where that ablative epidermal injury comes in. So that's those little scoops. Just you can kind of see them all over your skin. And we've got pictures of that. And then over the next week, 7 to 10 days, your skin starts to peel, and then you're left with what they kind of call a halo glow. So it's a nice resurfacing treatment. This is something people are generally happy with just having one. People often do like a yearly halo, but again, it's not something that you need a series of usually to correct your skin concerns. Most people are happy with just one.
And I was going to say, so, this does not the same as BBL, but they actually work. They both each work the best when done together. They can be done at the same time, and so they're, and in that regard, they're one help. They potentiate each other. And an important part of the healing process we've learned is there are a lot of pre-medication and pre-treatment and post-treatment things we can do, simple over-the-counter medications, and we'll get to a little bit more about the PDGF, which can help speed up the healing process here. So there is swelling, there is redness, but if a lot of times when you have something done, some of the pre and post things are people kind of take the grain of salt if it doesn't involve prescriptions, but it really does help here, I think, make people heal more quickly. And all these things really, even the halo to some degree, we found people when they have a halo, they're pretty unhappy with it. Could they do even better if they had a series? Probably, but people are in general pretty happy with it. But it's something you got to repeat periodically. But certainly the BBL, to get the most out of it, I think it's a series sort of thing.
Yeah.
But it just depends on the patient. Depends what your goals are too. I mean, some people's
Mhm.
goals are modest enough where one is definitely enough. Some people have a little more in mind, in which case a series of these is probably necessary. But it's very very tunable to what you're looking to do.
Yeah, I was gonna say there definitely are those candidates that need more than one halo to kind of reach their goal, with that deeper dermal
But
remodeling.
everyone gets the glow is something that we see uniformly.
Yeah, people really love that part of halo. Yeah. So this is kind of the bread and butter of the presentation and what we're really excited to talk to you guys about that we're bringing to the practice, and that is Ariessence Pure Platelet-Derived Growth Factors. We are one of the first aesthetic practices in the area to offer this, which is really exciting. This officially launched as a product in April of 2024. So it's been around for about a year as a cosmeceutical product or something used in aesthetic medicine. But PDGF itself is actually made in your own body. It's a signaling protein or messenger that tells your skin cells to repair and regenerate. So producing that collagen and elastin. So PDGF itself has actually been used in 4 FDA-approved treatments ranging from like orthopedics to dental work, and over 15 million people have been treated with PDGF in the past 10 years, I think, or so. So it's very well studied. As far as how this is made, it's biomanufactured. So the gene for PDF production is put into little bacteria like yeast cells in a bioreactor, and without getting too complex, that's all spun out, and you get this pure protein or platelet-derived growth factor signaling protein, which is really cool. It's kind of like how insulin is made.
Right. Same process.
Yeah, and what's really awesome about this is that some of you might know about PRP, or you might have heard PRF, PRFM. They're basically all versions of trying to basically do what this is doing. They're trying to, draw out your blood to get the stem cells in the platelet-rich fibrin matrix. And then they use that to microneedle it into the skin or inject it in the tear troughs. But the issue with that is that it's donor dependent. So it depends on your age, your lifestyle. There's no consistency. We don't have a way of knowing like how much of this product or of these growth factor proteins that you're getting when we're injecting PRP, PRF, PRFM. And what's great about Ariessence is that it's formulated in a lab. So we have everything, it's purely concentrated growth factor.
Yeah, and the goal of all those other treatments is to get, the plasma and the platelets. The goal is to get the PDGF in those substances. So their endpoint is the PDGF. So this kind of cuts to the chase and gives you the goods. And it's pretty well studied, and we'll talk about how it's applied in a little bit. But that's something I'm really excited about.
And it doesn't require blood draw, which is nice.
Yeah.
So this is an example of microneedling with PDGF. This is actually from the Ariessence website. I don't have any before and afters of my own with this treatment yet. But what's really great about this is it basically speeds up your healing, it reduces inflammation, and it takes your results that much further. Platelet-derived growth factors, once they're in the skin, which they're able to kind of really be delivered to where they need to be into the dermis, because we're creating those microchannels with the microneedling. So once it gets there, it's stimulating angiogenesis or new blood vessel formation. So that's going to help with circulation and glow. It's going to strengthen your skin barrier, strengthen your skin, and again, reduce your downtime, which a lot of people are looking for. So you can see this patient, she has melasma, which is a chronic skin condition that can be difficult to treat. Microneedling can be somewhat indicated as a treatment for melasma in conjunction with a lot of other therapies. But you can just see the improvement in her melasma after that microneedling treatment. And I would guess to say that a big portion of that is because the PDGF is involved as well. And then Halo with PDGF, so how we use this in our practice with Halo is applying it immediately after the laser. So we've created all of those little scoops, like I said, into the skin of the epidermis. So we have a direct channel deep to the deep dermal layers, and we're able to send the PDGF to where it needs to be so that it can boost your healing, reduce downtime, and help with inflammation. And then afterwards, it kind of helps with your glow and kind of boosts that healing post laser. So this is my patient before and at 1 week after her Halo laser treatment with PDGF added. We did her face and neck. She hasn't come in for her 2-week follow-up because she's just at a week. So the lighting's not consistent in this picture, unfortunately, but I really just wanted to point out her melasma. She also had melasma, which Halo can be great to treat as part of a treatment regimen. And if you just look at the clearance on her forehead and kind of the improvement in the melasma, it's pretty amazing to see. And also just kind of at the nose, just some of that vasculature is gone. In her mid-face, her skin tone just looks more even. Her pores look more uniform. And she also got, I would argue, maybe a little bit of a like tightening effect from the Halo as well, which is really cool. This is another Halo patient that I treated. So for her, we actually were targeting pore appearance. So not as best seen on camera or on picture as well. But what I wanted to point out for her was kind of the dyspigmentation improvement after one treatment under her eyes and how much better these brown spots are. She looks really dynamite in person. She just is glowing when she's in the office. She's one of our staff members. And she said that she's really happy with this treatment overall and that she would do it again. We were a little bit more conservative with her because of her darker skin type and we wanted to minimize her hyperpigmentation risk there with this treatment. And I think that we did pretty well. She had a little bit of hyperpigmentation around her mouth afterwards that she's been using some hydroquinone to help lighten. And she's, again, really happy.
One of the beauties of Halo is that, um, I think for a lot of our aesthetic treatments to treat the skin, people with more pigment in their skin are kind of left out a bit. These are skin types, and there was much more. There's a little more risk involved, but I think this is a device that really, because it is so tunable, the depths and everything, that you're able to treat folks that otherwise would not have a good option. And so it widens the circle of people that we can help with this. And the PDGF to boot helps the healing time. So
Yeah. And this is kind of like a trajectory of healing for you guys to see. So this is the microscopic little scoops that I've been talking about. You can kind of see it looks like a coffee ground appearance on her skin. And then over the week, that kind of flakes and falls off. People often describe that their skin feels like sandpaper and they get a little bit of peeling. So with this device, we usually say around 7 to 10 days downtime. But that doesn't mean that you can't go anywhere. So you might just not want your picture taken for like Instagram or something. But usually by day 2 or 3, people are pretty comfortable putting on their tinted sunscreen and heading out the door with like a cap, going to the grocery store, doing stuff like that. So it's not 7 to 10 days of true downtime, but we kind of estimate that for how long it takes for all those little mints to fall off and for like that halo glow to kind of really shine through. And you can kind of see it a week. That she's kind of all the mints have fully sloughed off. She's got a nice, beautiful glow. It's just very even and nice with her light reflection of her skin, as well as the tone is a lot more even than her before picture.
do we have any questions in the chat? I don't see.
I don't think
make sure
so
we
yet.
do, and make sure we hit them.
Yeah, you guys, please feel free to drop any questions in the chat. We can answer them as we go. And also we have a little giveaway at the end, so stay tuned for that too.
So yeah, so there's a question here about eyelid stuff. We'll jump to that in just a bit. We can finish up with the baby on it. We'll talk more.
Okay. Yeah, it was a question about eyelid surgery, about how you determine where he makes his incision, and he'll go over that in that section. So kind of finishing up with BBL, Halo, and PDGF. One thing you can do also to enhance your results is stacking treatments. Sciton calls it like a Sciton stacks. And basically it's kind of combining the BBL and Halo in one sitting. So you have the BBL addressing the reds and the browns in the face, the Halo for the texture and deeper dermal remodeling, and then the PDGF, of course, if we add that on for you, that's just going to boost your healing and collagen production, just take your results that much further. And what's great about these treatments is that stacking them together doesn't add any downtime to your 7 to 10 days if you decide to do the Halo. So, and then I'll turn it over to Dr. Bearden to talk about dark circles.
And so, we covered a lot there, and Zach does a great job and explains this very knowledgeable. So I really encourage you guys to kind of meet with them and learn more about this stuff. There's even more information than even we've given tonight, but he does a fantastic job. So we started kind of globally with face and skin stuff. We're now kind of narrowing down to around the eyes, which is kind of my super specialty. But we'll talk about the thing that I hear a lot about. And people say, I don't like my dark circles. Well, there's a few different reasons you can have dark circles. Some are more of like a skin thinning and atrophy as you age. And there's skin that's already pretty thin getting thinner exposes muscle and blood vessels beneath there that causes pigmentation, or you see pigment, or you see darkening rather. There's a genetic component to it. There are certainly some cultures and some families who tend to have more pigment around their eyes. We'll talk about that in a bit. Just plain visible blood losses. Also, the tear trough hollowing is a big one. Sun damage, lifestyle factors, and people with chronic congestion or sinus issues can actually have iron deposition around their eyes, which can cause darkening as well. And as far as, look at one thing here. So basically, I'll go through these there's different ways to address all these things. And a lot of what people need, people ask me this all the time, you really have to kind of lay your hands on folks and take a look at them and see what's really going on. For people that have thin or translucent skin, one thing I'm really excited about with the PDGF is that there are some people, and I'm not quite sure I feel about this, but there are some people who are actually injecting the PDGF below the skin to kind of help these areas. I think really, the issue people have in their lower lids, and you can see in these images here, people that have kind of dark circles. Some of these are pigmentation, but people will have kind of really thin skin over the rims or the kind of the tear trough area. A lot of that's the skin's just gotten so thin you see the blood vessels through there. But I'm excited about using Skinpen to help deliver the PDGF to that area to really just make the skin more robust and more healthy and more vibrant and basically have healthier skin there to then hide some of that darkness. That's a great way we can address dark circles created by atrophy or thin skin there, which you see as you age. Other people's dark circles, and like these pictures are good examples of this. Some of it's just straight up pigment. A thing I like to do in the office is people, will come in, I'll take a flash shot of them and a non-flash shot, and I'll show them that, if a flash is on, it negates a lot of the contour issues that cause darkness we'll talk about. But you can still see dark skin, and that's more amenable to treating with things hydroquinone. We have other pigmentation issues, or pigmentation treatments rather. But so dark skin, we treat with dark skin treatments. Thin skin, we treat with the PDGF and trying to make the skin more robust. Some people have actual darker, have tear trough or sort of hollow areas where there's actually a concavity or kind of a what I call the pothole sometimes, where light can't hit it right. Sometimes that's recontouring the fat. So we'll look at some of these pictures. And those are the big categories for why people have quote dark circles. And for some people, there's surgery versus non-surgery options. Like we just talked about, some people they have very small contour changes. They are really amenable to using filler, frankly. Filler's kind of gotten a little bit of out of fashion a bit right now. People are kind of out of their fill of it, for lack of a better term. But the truth of the matter is, and I'll tell patients this all the time, because they say, well, I don't want filler because it doesn't look good. Well, what I tell them is people that you see that you can tell you filler is because it's done poorly. So if done well, it's really something that looks natural and in the right patient can look natural and be the right treatment. I've had a patient today who came looking for surgery, and I really just steered her towards doing fillers. I think it's the right thing for her. As much as I enjoy doing surgery, it was the right thing for her. So we kind of tailor what you need. Other things here, the skin quality we talked about. And again, the non-surgical ones are things less downtime, like filler or using Skinpen and PDGF are all things that have less downtime. Surgery, of course, is usually because there's some degree of fat prolapse or true laxity of the skin we can't address with more topical things. We could use surgery to redistribute fat from where you don't want it to where you want it. We can also make the skin more taut or tight with laser. And this is a more sort of a structural sort of moving stuff around to kind of make to backfill where people tend to deflate. And these pictures will make this more obvious.
And I will say, I think a lot of people are having filler fatigue, kind of like you said. There's kind of a trend more towards people wanting biorejuvenative treatments, but filler, I would argue, does have its place in aesthetic medicine when it's used judiciously by a good provider that really understands your face. It definitely has its place in aesthetics.
You can't put a square peg in a round hole.
Yeah.
People, that's what happens a lot. So good example of this whole contour thing. Can they see this cursor?
Yeah, they can.
Okay, so basically, here's I love showing this picture. It's kind of a good wow factor. And this is pretty typical what we see. Here's a patient with not a lot of deflation, but she's got a dark circle here. You can see the shadow. This is a side shot, which makes it more obvious. But if you notice here, her mid face, the top of her cheek is very deflated. That's a very subtle but profound aging feature that really sneaks up on people. And I point out to them, like, they hadn't really noticed that. But that's a really subtle volume that they're losing. Is a very subtle but profound aging feature of it backwards. But what we do here is we can, in this lady's instance, because she's got some extra fat up here, we can hide an incision inside her lid so you can't see it, which is kind of cool. Then we take some of that fat, we get rid of some of it, but most importantly, we take some of that fat and tuck it deep in here on the top of her cheek to fill in and kind of a face, for lack of a better term, where she was hollow. And that has its own blood supply, stays there for good, and it really does a good job of backfilling where people tend to deflate. And so you can see here, if you can ignore the left-hand picture, this lady here looks like she hasn't any surgery on the left. on the right side, because it so naturally fills in here, and we sculpt the fat above it and it kind of blends in, looks seamless. And so the upper lid, of course, we shed a blepharoplasty there as well. But the point of the slide is really to look at how we can move fat around to where it ought to be. And we do that all the time with people, and people are pretty darn happy with it. So um, here's another example of someone who, again, flashlights kind of hide this. This lady's grinning. She's pretty happy, but you can see she's got bags down here, but she's kind of deflated on top of her cheeks. Afterwards, ignore the grin, but you can see she's got more volume here, and certainly the fat is less, is there's less prominent fat there. We did her upper lids as well. Here's a great example. I tell people all the time, if you look at the bottom picture, you would know this guy's had surgery, but at the top, it's really obvious. And that's what we shoot for, is people to not be able to put a finger on what you had done. And it's obvious if we got pictures. But this guy obviously had really big bags, really deflated upper cheeks here. We just borrowed from Peter to pay Paul and tucked this on top of his cheeks there. And he's got that volume now. It's subtle, but that's the way it used to look, years and years and years ago. And that's a youthful look. And of course, the fat prolapse is gone. So
And I will say, I love seeing your patients that are both male and female, because I think it's really important, that you choose a provider that has aesthetics in mind as far as gender differences. So with Dr. Bearden, he always kind of preserves those masculine features.
for sure.
And for women, he can help recreate them, because the face actually goes through a little bit of a defeminization as we age.
Right.
So
Yeah, that's a great point. Um, other things to point out. So this nice lady comes in and says, "Hey, doc, I don't like my dark circles." Well, she's got a little bit of both things. She has got obviously some excessive fat here, some troughing of her tear troughs here. She's a little deflated there. Not a ton of deflation, but a little bit. But she's also has some dark skin. So for her, we basically took some of the fat and got rid of it. But we tucked some here at the top of her cheek to give her just a little bit of volume, so it kind of blends in. And now she's got to go to work on actually making the skin less dark with hydroquinone or other pigment correctors we have. So hers is sort of a two-step process. But she's an example of someone who has a little bit of both issues causing the quote dark circles. Here's a few more pictures showing a lot of the same things. Here's someone who has bags, has crepey wrinkling of her skin. She's deflated on the top of her cheek, and afterwards you can see how she's got more volume on the top of her cheek. The skin's more taut, and of course that bag is now blended in with the rest of her cheek. Somebody with really severe bloated bags, you can see her afterwards. So she's got less of the bags here, and the cheeks are a little more full. And then over here where this lady's upper lids.
And did you want to talk about CO2 at all? CO2 laser resurfacing?
Yeah, I mean, I just kind of blew over that. But basically, so we do CO2, which is the laser, which is, for such the eyelid skin is the thinnest skin in the body. So it's really minimal to CO2 laser, which is the type we use in the OR. We have in the office now as well. But really use it in conjunction with the surgery. And then, actually, the best example, I'll show you this patient right here. You can see how she's got the crepey wrinkling of the skin, and afterwards the crepiness is gone. So we did two things. We got rid of the crepiness or the wrinkles, but also moved the fat around. Same with this nice lady down here. Her wrinkles are a lot better, not gone, but a lot better, but also we kind of move the fat around and try to hide some of her festoons there with the fat we tuck next to it. That's a really great thing we can do a lot of. And this isn't my best example of it. Basically, some people carry fluid at the top of their cheeks, and by putting fat adjacent to it, it helps masquerade it a bit. It's still there, but this is a good example of this. This little bit of fluid there is not fat. That's just fluid she has. It's still there afterwards, but fat adjacent to it is kind of like, it stands out less in relief because you have volume next to it, and so it helps masquerade it. And of course, we laser the top of it as well, but so we can address all the things going on in the lower lids. But we're really happy to add the PDGF. The real bugaboo for surgeons is that the people that have, really atrophic tissue down here, they don't have a lot of bags, but they have atrophic tissue. I don't have a great picture of that, honestly. But they are the kind of people who benefit from the PDGF being applied to the skin in that area. In the past, we really haven't had a great tool for that. The stiller's not great for them. They don't have extra fat to get rid of, and they don't necessarily, a laser can help some, but I'm really excited about using the PDGF in that regard.
Yeah. It'll be great to speed up healing results, and also, I think, help strengthen the skin as well.
For sure. We're going to use it for a lot of different uses. And just to kind of visit briefly, other things we do, neuromodulators or neurotoxins like Jeuveau and Botox. We talked a bit about filler and how they're getting a bad rap these days. They'll come around. They'll people sort of like them
Yeah.
again, but they're great for the right patient. They do their jobs. And speaking of biostimulatory, even HA fillers to some degree generate some inflammatory response. So people who have fillers, when I do them in the teardrop or somewhere else, and they come back in a year, and it's almost never all the way gone. It's partially gone. So you get some residual volume there just from the reaction to the stuff. That to a much larger degree is Sculptra, which is designed to actually create stimulation of your collagen cells, and it's done really deeper fashion you would use PDGF. But for Sculpto, we think that's a great tool for that, especially for the people who, people that are, one of the prices you pay for being in shape and being older is your face thins. And the Sculpto is great for folks with the thinning in the temple areas and the cheeks. They kind of boost that and give them the volume there and the youthfulness that they used to have. And of course, Kybella is for, people that carry that pocket of fat beneath their chin for melting that. It works pretty darn well. So those are other things we do as well. Um, any more questions that are? Oh yeah, somebody asked earlier about where do you cut, and so that's a great question. And I didn't. I just kind of basically for an eyelid surgery. Find a good one here. So this guy up here, under that fold of skin, there's a crease. We hide the incision up in there. So really, an eyelid incision is probably the best concealed incisions in the entire body. So we can hide up in that crease there, and it's almost undetectable up here afterwards. For the lower lids, the bags, we hide that incision inside the lid where you can't see it at all. There's an incision back there, but it's completely hidden. So that one's seamless as far as the skin. And we do that because when you make incisions in the lower lid beneath the lashes, it tends to weaken your closure and those muscles lose their tone. And so we learned that's what the way people did it back in the 80s, but we've learned in the last few decades that making an incision in the back of the eyelid is better for folks. Let me see here. So one question. So we kind of answered that question. The one of the questions here is if you guys would like to sit down and meet with us, how do you get in touch? Here's our closing page, and we have our Instagram handles on the left, and there's our phone number for the office and the website, and we encourage you to check those things out and come see us. Any other questions? Now that we're to the questions portion that folks may have, they can put in the chat. We're happy to answer them.
Yeah, I would love to set up a consultation with you. You can always call the office, or you can always DM me on Instagram if you're coming to see specifically me. And you can schedule a consultation with either or both of us at the same time.
Sure. Well, let's see if we have
any other questions that you guys have.
Well, an hour is long. As great as we are, an hour is long for anyone. So
Yeah.
we're going to let you guys go. Thank you for joining us tonight.
There's one more thing though, our giveaway.
Oh, the giveaway.
Yeah.
Yes.
So giveaway for today is a complimentary neuromodulator or Botox consultation with me. So you have to follow Dr. Bearden on Instagram at Bearden Plastics, and then me at Zach and Scrubs. And the first person to DM my account, Fresh Face, will win a free Botox treatment.
So go for it. And thanks again for joining us tonight. And please come see us. Have a great day.